Ano ang simptomas ng diabetes? Kain ng kain, inom ng inom, ihi ng ihi. So if you're diabetic, your immune system is compromised. So we call them immunocompromised people. And it means that your body isn't able to fight those bacteria, viruses, fungi, whatever it is that has invaded your body. Okay, so if you're diabetic and the sugar in your body is too high, the sugar is what it does is that it slows down the movement of your white blood cells, so they cannot move as much, so they cannot go into the area where you had the damage and just remove all of the debris and to function properly. So usually you would have, if you're diabetic, you would have wounds that are difficult to heal. It would take a while, and sometimes they do not heal. And in severe cases, the doctors might see that it's already dead or necrosed. That's the medical term that they use. So they might amputate that part of your body. So what you can do, first thing foremost, is to manage your blood sugar, your elevated blood sugar. So try serpentina, insulin plant, garlic, ginger, of course. You boil that and you drink that 3 times a day. Chromium, magnesium, selenium, sulfur, and zinc. So these are some of the multi-minerals that you can take in. So I'll be releasing another product. So it's gonna be either next month or the succeeding month. And it's very good for diabetic. It's called diabetes. So for the meantime, if you have a problem with the wound, what you can also do is that you can wash the wound using white vinegar. And after that, if it's too dry, you can put some virgin coconut oil on top of it. So I hope that this short video was able to help you. Well, diabetes, you have type 1, of course, and you have your type 2. For the type 1, they usually give you insulin. It's your insulin is low to 0. And for type 2, you have your insulin resistance na tinatawag. I mean, the cell, there's insulin, either hindi masyado maganda, poor quality yung insulin ninyo, or you have decreased sensitivity of the cells, so yung tinatawag natin insulin resistance. Okay, so yung cell mo, nandyan yung insulin, di naman niya pinapansin. Now, the most common herbal medication that they usually use is serpentina, the ones that are very, very bitter. Momordica charantia, which is your bitter herbs, okay, your bitter foods. That's the ones that you don't like.
Bitter gourd?
Yeah, the bitter gourd, ba? Okay, so that's good for you. And of course, chromium. The chromium is a part of your IGT, your not IGT. Yeah, not GTC. It's glucose tolerance factor. GTF, yun pala. So it's part of your glucose tolerance factor, your chromium with insulin and then glucose. It will enter into the cell, okay? Magnesium also. Magnesium, zinc, and sulfur. Ayan, lalo na yung sulfur kasi that's part of the insulin, the chemical component, yung structure ng insulin. Part of that is your zinc and your sulfur. So pag tinignan mo yan, meron silang sulfur and zinc. So it's better also to eat foods that are rich in sulfur and zinc. Okay? Especially magnesium yan. Talaga maganda talaga yan. What can you do to clear for the eyes, diabetic retinopathy? Of course, you have to address the diabetes. Okay? Always, that's the first thing to do. You have to address it. You have to make the dietary changes like what I said. And the one that can really help you is Eye Bright. It's a plant, okay? You can also eat it, and you can also put it as a drops in your eye. So if you're interested in that plant, it's called Eye Bright. So look at it in the Google. It's very easy right now, so you can see the plants. And if you're still not sure, just private message me, and I will help you find it for you.
ALL.
So we can discuss about diabetes.
Yeah.
Okay. So again, the more important minerals in diabetes is chromium, zinc, sulfur or selenium, another, and magnesium. And these are the foods that you typically see. These are the minerals that you typically see in green leafy vegetables. So if you are diabetic, it's better that you consume foods that are which are green leafy in nature. Yan. So, kumain po kayo niyan. And for me, like what I always tell my patient when I was in Phil, huwag ka nakakain ng matamis. Okay? Kasi ang diabetes talaga, they're very, very sensitive to sugar. So, sabihin mo na lang, isipin mo na lang that you're allergic to sugar para hindi ka na lang masyadong kumakain ng asukal. Okay? Because the higher your sugar in the blood, the more complicated your diabetes would be. So if you are diabetic, of course, the complication would involve your eyes. So you can have retinopathy, pwede ho kayong mabulag. So yung puso ninyo, you can have a heart attack, okay? So hypertension as well, pwede ka rin magkaroon ng sakit niyan. And my dad died because my dad is diabetic. He had a complication in the kidneys. So pwede ho kayong magkaroon ng chronic kidney disease. So, yung mga complication na yan, di ba? Tapos, pwede rin ho kayo magkaroon ng peripheral neuropathy, which affects yung mga blood vessels ninyo, mostly going to your hands and to your foot. So, yung mga yan. Tapos, pag nasugatan ka, hindi mo alam nasugatan ka na pala, you would have complicated or non-healing non-healing wound. So, pag nagkaroon ka ng non-healing wound dyan, pwede pa na ma-amputate yung paa ninyo. So,
in English
be careful.
Too, Mom.
Yes.
You're talking all together.
So,
there are a lot of fans in English
as well. Okay, so because a lot of Filipinos are asking that they're asking if I can talk in Tagalog much more than in English. Okay. So, yun po ang complication ng diabetes. That's why it's very important. The good thing about diabetes is that it's a lifestyle disease. So, nakuha ho natin yan mostly sa ating pamumuhay. Okay. How we live, how we eat, how we exercise. So, if we don't exercise, we don't maintain a healthy BMI, body mass index. So, mas mataas, tataba kayo, yan, magkakaroon ho kayo ng insulin resistance. So, just be careful, okay po? Yeah.